Welcome to this explainer. You know, if you or a loved one has recently been diagnosed with sleep apnea, you've probably been hit with this totally overwhelming alphabet soup of medical terms: CPAP, BiPAP, PAP therapy. It's a lot to take in. Honestly, it can feel like you're suddenly expected to be a licensed respiratory therapist just to get a good night's sleep.
But don't worry, we're going to clear all of that up today. The ultimate question you're probably asking yourself right now is pretty simple. Which machine do I actually need? Well, today we are going to completely demystify what these devices do, how they differ, and exactly how sleep specialists figure out which one is right for your unique anatomy.
Here is our roadmap for today. We'll start by decoding PAP therapy, look at the standard CPAP, break down the BiPAP difference, put them in a head-to-head comparison, and finish up with some common mistakes you'll definitely want to avoid.
All right, Section 1, Decoding PAP Therapy. Let's build a quick foundation before we start comparing machines. Okay, so here's the crucial starting point. Both of these machines actually fall under the broader umbrella of PAP therapy, which stands for positive airway pressure. Basically, this means that both the CPAP and the BiPAP share the exact same mechanical goal. They both use pressurized air to physically keep your throat open while you sleep. It's all about preventing those dangerous tissue collapses that cause you to stop breathing and drop your oxygen levels during the night.
Moving right along to Section 2, the standard CPAP. This is the baseline tool for most folks. CPAP stands for continuous positive airway pressure, and the absolute key word there is continuous. A CPAP machine pushes a constant, set pressure of air all night long. It doesn't change when you breathe in, and it doesn't change when you breathe out. It just creates this steady, invisible airway splint that holds everything open.
And look, there is a reason CPAP is the absolute gold standard for adults with mild to moderate sleep apnea. Research shows that if you can stick with it past that, kind of bumpy first week of getting used to a mask, the changes are just incredible. Patients report waking up with way more energy, 0 morning headaches, and a massive reduction in snoring. And even more importantly, it actively decreases the danger of long-term issues like hypertension and heart disease. For most people, this one simple device gets the job done perfectly.
But hey, it isn't perfect for everyone. Take this raw feedback from an actual patient. I feel like I'm trying to gasp uphill. Since CPAP uses that one continuous pressure, exhaling against the steady stream of air can feel super unnatural or just plain exhausting, especially if you're on a really high pressure setting. A single continuous pressure just doesn't work for every single body out there.
Which brings us right to Section 3, the BiPAP difference. This is the specialized alternative for when CPAP just isn't cutting it.
So BiPAP stands for bi-level positive airway pressure. The secret sauce is right there in the name. 2 different pressures. When you inhale, the BiPAP ramps up the pressure to keep things open. But when you exhale, it dynamically drops that pressure down. It creates this much more natural, breath-like cadence. You are no longer fighting against a wall of air when you breathe out, so every breath feels so much easier.
Now, who actually needs this? Well, BiPAP isn't just a luxury version of a CPAP. It's a medical necessity for specific, complex situations. If you need a really high pressure to keep your airway open, BiPAP makes it tolerable by dropping the pressure on the exhale. It's also a total game changer for patients dealing with other respiratory conditions, stuff like chronic lung disease, COPD, heart failure, or obesity hypoventilation syndrome. A lot of times, these patients struggle to clear carbon dioxide, and that dual pressure system actively helps with breathing effort in a way a standard CPAP literally can't.
Okay, Section 4, head-to-head comparison. Let's do a direct clinical showdown.
Just to really hammer home the core mechanical distinction here, CPAP relies on that one continuous, one-size-fits-all pressure formula. BiPAP uses dynamic, split pressures for inhaling and exhaling. That is the fundamental difference in how they support your breathing.
And that mechanical difference trickles down to everything else. CPAP is best for uncomplicated, mild to moderate apnea, while BiPAP is the go-to for complex conditions or serious CPAP intolerance. Because CPAP machines are simpler, they're generally cheaper upfront and easier to maintain. BiPAP machines are noticeably pricier and often a bit bulkier for travel. But trust me, when you have a complex medical need, that improved comfort and breathing support absolutely justifies the extra cost.
Quick reality check before we move on, though. Neither of these machines is a magical cure. They are long-term, highly effective management tools. If you stop therapy, your symptoms, those scary breathing pauses, and all the health risks, they come right back. Consistency is absolutely crucial here to protect your health.
All right, final section, section 5, avoiding common mistakes. Let's talk about the predictable traps people fall into.
Let's break down the 3 biggest errors. First, judging your comfort after just one single night. Your body literally needs time, usually up to a week, to adapt to sleeping with pressurized air. Give it a minute. Second, assuming BiPAP is just a cool tech upgrade you should buy if you have the cash. Like we've seen, it's a completely different tool for a different breathing pattern. And third, self-prescribing based on an article you found online or a setup your friend uses. No 2 anatomies are exactly alike.
Here's a wild fact. Well-meaning people will literally spend thousands of out-of-pocket dollars to switch to BiPAP for comfort, only to find out they are still miserable. Why? Because the machine wasn't the problem. Comfort issues are always fixed by getting a better mask fit, adjusting your strap tension, or having your doctor tweak your CPAP pressure settings. A bad mask fit is usually the real culprit, guys, not the machine itself.
So I want to leave you with this final provocative question. Are you guessing or are you testing? Finding the right machine isn't about trial and error in your bedroom. It is about a proper medical evaluation and a clinical sleep study. Your doctor actually needs to look at your specific test results to match the right pressure pattern to your unique needs. I really hope this explainer has empowered you with the knowledge to have a much better, more informed conversation with your specialist. Take care of your sleep and keep learning.